The content discussed on this program is often medical in nature and is used for informational purposes only. No content discussed should be taken as medical advice. Please consult your healthcare professional for any medical questions. Hi, I'm Tori McGee, and this is the Rapid Recovery Report sponsored by ROMTech, the modern technology of rehabilitation. So we're going to be doing this series bi-weekly, I think, on Thursdays at 4 p.m. Pacific and 7 p.m. Eastern, where we talk to different guests. So we're going to have surgeons and patients and insiders here at ROMTech, physical therapists, just basically all kinds of people that are in the health industry to talk about wellness, health, and touch on ROMTech's Portable Connect. So if you are new here, this little beauty is the Portable Connect. Isn't she cute? It is a high-tech recovery device that is geared at getting patients moving faster. It's got passive modes in it, and most importantly, all of the data that is happening while you are on this device at home is being sent to your surgeon so that they can kind of keep tabs on you and know what you're doing at home. So if you want to learn a little bit more about us, you can visit us right there at www.romtech.com or follow our social media handles that are in the description below. But let's talk about our guest that we've got here today. So we've got Dr. Dr Knoll. He's a joint replacement specialist at Tri-State Orthopaedic Surgeons in Evansville, Indiana. After graduating Summa Cum Laude from the University of Notre Dame, he attended medical school at Case Western Reserve University and then completed his residency in orthopedic surgery at Wright State University. He continued his training with a fellowship in adult reconstruction at the University of Virginia, which allowed him a full immersion in all aspects of joint replacement and arthritis management. Dr. Knoll's practice includes the full spectrum of hip and knee replacements, including complex revisions and direct anterior hips, as well as fracture, trauma care, and general orthopedics. So hi, Dr. Knoll. Thank you for taking the time to hang out with us today.
Hi, Tori. My pleasure. Glad to talk to you.
Perfect. So this is something that I just feel like I have to know. We ask all of our surgeons this to start. So what inspired you to make a career out of orthopedic medicine?
So it's a good question. I kind of was always liked medicine and always, felt like that was kind of an avenue I was going to go. But, kind of if I didn't do medicine, I feel like I'd be in some sort of, physical science or, something with physics and things like that. And so for me, orthopedics and even specifically joint replacement really melds those two together because you get the humanistic side and the, patient care side of medicine, but also with the physics, with the science and the biomechanics that I also enjoy. And so it really works as a nice combination and really fits me well.
Good. Well, it sounds a lot more complicated than anything that I could do. So I'm glad you went into it instead of me. So when we spoke with you a little bit before the show, you had shared with us the importance of what a patient does prior to surgery, and then also during recovery, and then following a complete recovery after an arthroplasty. So we're curious to learn and share with our audience, what does prehab mean?
So it's a great question. And prehab is really, to me, kind of where it all starts. So, I use the analogy of if you decide you want to go run a marathon, generally you don't just wake up on a Saturday morning and go run a marathon, right?
Yeah.
That's probably not going to end real well for you. You're going to start your training, right? You want to build your body up and get ready for it. And the same is true for a surgery like a knee replacement. So to me, prehab is a really a critical part because intuitively, well, the stronger you are when you walk in that day of surgery, that much better position you are starting your recovery coming out. And so prehab, it's a balance of being able to work on the range of motion, the strength, understanding that, well, if you're talking about surgeries, because that knee doesn't feel very good, so it's hard to do, but there's kind of specific exercises that can be done that are done in a gentle way, but you can get that strengthening, you can get that range of motion, which is going to set you up for success and put you, a step ahead of where you were before the prehab, even before the surgery starts. So it's just all that, kind of the more you can do ahead of time to be ready for the surgery, well, the better your recovery is going to go.
Yeah. So how long do you usually suggest prehab, and what are you asking your patients to do during that time?
So how long ahead of time? Usually about the time we start talking about surgery, that's when I say, hey, start it. It's kind of the sooner you start training, the better. So, at least several weeks beforehand to really kind of get the knee in that mode and get ready for it. But some patients, for one reason or another, it ends up their surgery is going to be a little further out. And I say, hey, go ahead and start now, right? The more time we have, the stronger it can get. So, the activities that we're doing there is generally very low impact things. So it's working on even straight leg raises where it's just, sitting in a chair, bringing that leg out straight and then lifting it up off the, the bed of the chair. It's surprising how much that'll work your quads, just lifting your leg without weights on it up off the bed a few times in a row. And that can really help strengthen it. I tell people, a couple times a day, if they're watching TV, you prop the heel up on a ottoman or a coffee table, put a bag of frozen peas, something with a little weight on that knee, helps stretch it out and straighten it out. So it's not that I'm getting them in the gym and doing all these, crazy workouts you see on TV or anything. It's really pretty simple stuff, but it goes a long way to get that knee ready, get it as loose and as ready as we can to undergo surgery and start the recovery.
So should I be doing leg lifts under my desk while I'm working?
I would recommend it. Yeah. It's the same way on the other side. People tell me, hey, when should I stop doing therapy? I say never. It's just, it evolves. You can change from those, early post-op exercises to doing more general strengthening and everything else. But whether or not you have knee arthritis, doing exercise is a great thing.
Yeah, not going to hurt.
Exactly.
So once a patient undergoes a joint replacement, what does a typical recovery look like, and how long can a patient expect for a complete recovery?
Yeah, so that's a great question. And it's a little different for everybody. Some of that to go back to the prehab, it depends where you are when you start, right? And so, the stronger you're coming in, the better your recovery is going to go. But in general, I look at the recovery in phases. So that, initial phase is really just kind of getting over the acuity of the surgery, trying to get that swelling under control and getting back that motion. Because as soon as you have that surgery, that knee wants to stiffen up and you got to kind of work against that to get that motion and everything. That's that critical first couple weeks there. So those first couple weeks, in my mind, you're kind of really focusing on that motion. As I tell patients, I'm not trying to get you to go out and go on long walks outside. I want you to get that motion, get that swelling out of there. And then once we achieve that goal, which, hopefully is within that first 10 days to 2 weeks or so, then we start adding in a little more of that activity. And, you're up and walking during those first 2 weeks. It's just not long distances or things like that. Over those next couple of weeks, that's when you're getting out of the house, you're taking some walks, you're getting a little more active with it. May or may not still take a cane with you just to have some support, but you're feeling like yourself a little more.
Sure.
Once you get past that phase, that's in that 4 to 6 week range, that kind of thing. That's where you start really getting a little more adventurous. You're going on longer trips to the store, or people starting to get back to the driving range and hitting some balls and and things like that. And then it's just progressive from there. So, a complete recovery does take a while, but even though the number seems like a long time to say, hey, it's a couple of months before you're yourself again, it's not that you're on bed rest for 6 weeks leading up to it. You're getting better each day, each week. It's just before you really say, oh my gosh, I can, go do everything I want to do. It does take some time to get there.
Yeah. So now, are there special rehab instructions that you generally share with most of your patients? And does it differ if it's they're arthritic and that's why they're going through surgery?
So a little bit. What I do, because a lot of people come in and they say, well, what should I be doing at this point? How far should I be walking and things like that? And I don't put a specific on it because everyone comes in at a different level. I can in the same day do surgery on someone who, wants to get back to going, skiing and rock climbing, and someone else who is, more sedentary, and their goal is to get to the mailbox and back. And so they're going to be all along the way at different time points of what they're doing. And so, my instructions kind of go back to what I said. It's more in the phases of, I want you kind of got to, crawl before you can walk before you run. Right. And so that's get that motion. And so I say, when I see you back, I usually see my patients back at 2 weeks. My more important thing is not how long of a walk have you gone on? It's, let me see your motion. How's your control of your quads? Can you straighten that leg out? Can you get the motion there? Once we establish that, well, then, start increasing it. And what I often tell people is I say, well, as you get to that phase where you're doing more activity, kind of look at what you did today. And if at the end of the day you say, okay, my knee's still doing okay, well, then tomorrow do a little bit more. But I don't tell them, okay, today go walk a quarter mile. Tomorrow I'll do a half a mile, because everybody's a little bit different as far as when they get to those points. It's just as long as you are each day doing a little more, getting a little stronger, and doing a little more with that knee. Yeah.
Now, what happens when your patients don't do the prehab, or if they don't follow the rehab protocols? And do you have a lot of that?
No, I don't. Fortunately, I don't have a lot of that. I think the big thing there is explaining. I think it's when people understand why they're doing it, it makes a big difference. Because if you just say, "Oh, here's a list of exercises, go do them," if that doesn't have the same effect as if you explain, well, this is why we do it, and this is how it's going to help you, and how in the long run it's going to be better for you. So, fortunately, I've got a pretty good patient population that, they're going through this to take some ownership, and they want to get better, right? And so that makes a big difference. But yeah, are there times where people fall behind? Definitely. And so that's where, I'll see them periodically, kind of check on their progress. And sometimes it takes a little encouragement, because the knee hurts afterwards. There's
Right.
no ifs, ands, buts about it. It does. And sometimes, we feel that pain and say, oh gosh, well, I think I might be doing damage here, and I hold off. And so there can be that where you say, oh, I'm not going to do my exercise because I think it might hurt more. And so coaching people that, actually moving it, using it is going to help ease that up. It's going to help make it better when you get back on track. And oftentimes that's enough to get people back on track. Sometimes if we get really far behind, there are options where we can go in and I can do kind of a guided, it's called a manipulation, where we give people some sedation, some medication that really kind of push through to help them get their motion. Fortunately, that's pretty rare that we have to do that, because with the protocols we have in place and, kind of checking on things and the checkpoints we hit, we can usually prevent it before it gets to that point.
Good. Good. Because that sounds not enjoyable at all.
Yeah, it's less than ideal. It's a lot easier to stay on track with a therapy and reach the goals the normal way.
Yeah, absolutely. So are there different types of injuries that can happen if patients don't follow normal protocols? I mean, I know that, we talked about manipulations to kind of get them there. So I assume that they're fixable. And like, what should a patient look for if they start to fall into one of these categories?
Yeah, so the big things is really just kind of, again, I mean, it's what how the motion's doing, how the activity is doing. And, even though there's not, a set like, okay, by 4 weeks, you should be here, 8 weeks there. Yeah, there are kind of some general principles. And so, if that motion isn't getting where you're all the way straight and getting past, 90 or 100 degrees of flexion within about the first 2 weeks, that's where we're starting to kind of fall behind. So that's kind of where I give patients some parameters. I like you to be, off of assistance devices about that, 2 to 3 week mark, that kind of thing as well. And so there's kind of some of those bigger kind of guiding principles that we kind of go with. And so we can use those to judge, where people are at, and they're aware of where their goals are, or I try and make sure that people are aware of where they need to be, so that, I say, hey, of course, we're falling behind, call me, let me know, we'll get them in, talk through it, figure out what's going on. But, as far as the injuries and things like that, I mean, there can be injuries in there. Fortunately, we don't run into, really major injuries with them, hardly ever. I mean, of course, you can have an infection. There can be an issue with the incision, things like that. But, we being surgeons in general, I think have a pretty good deal on that it's pretty uncommon when we have one of those, kind of a major injury, maybe aside if there's an unfortunate fall or something like that. But, the big injuries are pretty few and far between. Most things are correctable.
Yeah, well, that's good. See, and so don't let a big surgery, folks that are watching, deter you from this, because it's a very rare instance that something will not turn out the way you want it to.
Right. Yeah.
Now, once a patient reaches full recovery, what is your typical advice to keep them from having to come back and see you again? So any like long-term maintenance that's associated with a knee replacement that they should know about?
Yeah. So based on what I said earlier, I bet you can guess what I'm going to say, but is that keep it strong, right? Keep it strong, keep active. And, all our joints in our body and everything, I mean, they want to be moving. And, one of the interesting things, and there's not really a study out there, but I've just at least seen this anecdotally, is that, when COVID hit, we have a lot of the population that, used to go to the gym, or, hey, I used to go out walking and do this regularly, and stuff kind of came to a halt. And so I have a lot of people who, when that hit and when that happened, over those ensuing months and even 6 months afterwards, man, my knee hurts me way more than ever now. Or, these things, they just hurt. And I say it's like a car. If a car sits in a garage and you don't drive it, well, the battery kind of dies and the oil gets thick and all that. Your joints and your body's meant to be moving, meant to be used. So I say long-term is use it. And of course that's within reason. I mean, I don't need you going out and starting a tackle football career after having a replacement, but almost everything you can do, go biking, go hiking, go swimming, go, on walks, go golfing, bowling, whatever it is you want to do, all those things, but staying active and keeping up with exercise, keeping it strong, and keeping that range of motion, that keeps you away from seeing me again. It really does.
Yeah. Well, a body in motion stays in motion, right?
Absolutely. Absolutely.
And I've got to talk about it since we kind of brought it up at the beginning here. So you've been using Romtex Portable Connect for a lot of your patients' rehabilitation treatment. So
yeah.
What kind of results and impact are you seeing with your patients so far since implementing that?
So I've really loved using it, and my patients have as well. And so I started using it in about April. So I've had it for about 6 or 7 months now that I've been using it. And it really, when I first found out about it, I kind of was like, I like that, because it really goes along with kind of my philosophy of kind of the crawl, walk, run kind of thing, where the first thing is getting that motion. And right now, or I say the traditional way of doing it is going to physical therapy 2-3 times a week. And that's a session that a lot of patients dread, because you're going there and, you have this therapist, very much means well, but, they're sitting here and kind of cranking on that knee and pushing it up. And you've got this, one time every 2 or 3 days, you're doing that. You're kind of trying to do exercise on your own at home, but you don't really know what you're doing. And am I doing too much? Am I doing enough? And so it becomes a real painful thing just to get that motion. And so with the bike, being able to make those revolutions and start out with that small, arc of motion, having the passive mode that kind of transitions into the active mode, and doing it broken up, 5 times a day, where it's these little sessions that you kind of do incrementally. It just makes it so much easier. And so I've had patients, my favorite ones are the ones that I did a knee on, say December last year, or, before I had the bike, do one side, and they go through traditional recovery and do well with it. But then have had a second knee replacement now and have the bike, and they say, man, I wish I had that the first time. It was so much easier this time around. And I've had a number of people who, after finishing the bike say, man, I'm getting an exercise bike. Now that I have this, I can get that motion. I want to kind of keep this going. And, obviously that's not the same thing to just have an exercise bike, but as an ongoing for the thing, they see the value of it and everything. And so it's really been a good experience. I've seen patients come back, getting off of assistance devices earlier, and the convenience. I mean, they really you don't have to have, hey, who's taking me to therapy, and, sitting there for an hour twiddling their thumb while I do this 3 times a week. Yeah. It frees them up. And so I've gone where I don't even send patients to physical therapy. They get their exercise and their work at home.
Wow. That's awesome. And I mean, how long do they say it takes? About 2 or 3 weeks to create a new habit. And so if they're on this portable connect and moving, all of a sudden they have a habit to move. So hopefully, it will keep them from seeing you again if they're just active all the time.
Yeah.
So, all right, we've got just a couple more minutes left. So I wanted to ask one more question. What would you tell other orthopedic surgeons about the portable connect for those that might be watching?
So I would say give it a chance. I mean, I would say that, it's always, a little bit of a challenge of bringing something new in, because, most of us that, doing knee replacements really get good results. Doing physical therapy works, and, people do well. And in the end, they have a successful knee that they're happy with. But I found that, through the process, in those early weeks in recovery, it's just more comfortable. People like it. They enjoy it. The convenience of it. The, like I said, the doing it, breaking up multiple times a day, having a guided nature of doing it on a regular basis at home. That, I have patients who say, man, I wouldn't do it another way. And, or I'll, do a wife, I've done their husband previously. And, of course, they say, oh, this is great. And the husband says, well, man, why was that when I had mine? And so I think it's been a great addition. It's easy to use. It actually, I think, makes even things easier for my staff, because there's less question, there's less, issues that are happening, things like that. And so I say give it a chance, because it's really been a nice product.
Perfect. Well, thank you so much. I think that's all I've got for you here today, Dr. Knoll. I appreciate you taking the time to answer some questions and hang out with us.
Hey, happy to help. Thanks for having me.
Yeah, of course. So for those of you that want to check out Dr. Knoll, you can visit him at www.tristate-ortho.com. They're on Facebook. You can follow them on Instagram at Tri-State Orthopaedics. And then, of course, feel free to subscribe to our channel here so that you can get all of this great information. Check us out at ROMTech.com. And until next time, thanks again, Dr. Knoll. We appreciate it.
Thanks for having me.
Yeah. See you guys later. Bye-bye.